Wonderful. Welcome, everyone. As folks are just signing on to the webinar, I want to extend just an incredibly warm welcome to all that are joining us from all different time zones and truly all around the world. We'll give a couple of moments for people to sign on, get registered, get comfortable. And our webinar will begin in just a couple of moments. So welcome everyone as you're settling in, and we'll get started in just a couple of minutes. Oh, it's such a treat to see everyone signing in here in the chat and joining us for this third webinar in our series. We've had a mini series running this week, as many know. And it's just been a really robust forum for discussion and dialogue across settings on a number of the areas that are priorities, gender equity and gender-based violence, and really having an opportunity to discuss about emergent research really from this upcoming generation of scholars and evidence advocates in this space. So I'm just giving a couple quick remarks as we get started. I'm starting to see our attendance start to populate over here. So we'll go ahead and get started. I'm Michelle Decker. I'm a professor here at the Johns Hopkins University at the School of Public Health. And I have the pleasure of leading our Center for Global Women's Health and Gender Equity. And I'm really delighted to welcome everyone to our webinar today. We have three exciting panelists for you, panel presentations. And I'm kicking off our webinar, which is Evidence in Focus, Emerging Research on Gender Equity and Gender-Based Violence. Today, we'll be hearing emergent research and new results from Botswana, Honduras, and the Kurdistan region of Iraq. And I'm so thrilled to be in this virtual space with all of you. Our webinar today is lifting up and sharing out, showcasing some results from our Evidence Accelerators program. This is a global program that has been a signature initiative of our center. We undertake virtual coursework, mentoring with Johns Hopkins faculty, build a cohort experience, run series of data labs, presentation training, and work with scholars on many projects over the course of the year. We meet a couple times in person and really foster connectivity across regions so that we can learn together and advance the evidence together in key areas of gender equity and gender-based violence. So you can imagine how delighted I am today to be able to share out and open this session, which is going to share out learnings from three of our evidence accelerators with really important findings across three different regions. And I'm extra delighted as well to have one of our inaugural evidence accelerators give some opening and introductory remarks to share out some of the ways in which the training and the program have percolated and continued to foster evidence and advocacy at the forefront of gender equity. So this is my way of introducing. I'm so delighted to have Trisha Bacedo-Gobin joining us today from the Caribbean region. She brings longstanding research and advocacy in the area of gender and social development, including consultations with the Inter-American Development Bank and a really longstanding history of civil society organization that brings to the fore the evidence and the ways in which we can use evidence to advance discourse and policy and programming. And Trisha was one of our inaugural evidence accelerators, and I'm really delighted to turn the floor over to her for some introductory remarks and comments as an alum of the program. Trisha, over to you.
Yeah, thank you so much, Dr. Decker. It's really a pleasure to be here, to see so many familiar faces, and of course, to be part of this second cohort's presentation. It's really an honor. I wanted to reflect a little bit on my own experience, and while reflecting, just to really honor that the program played an important role in strengthening how I approach my work. In particular, coming from the field already and having entering into the program with that knowledge of gender-based violence, in particular, this program really helped to deepen, to strengthen my capacity, particularly in quantitative data analysis. In the sense that it gave me greater confidence in working with data to inform more effective and targeted responses. And fast forward to what, 2 years now, I think it pushed me to really think more critically about the link between how, when we think about research and practice, how that work we produce can really and should directly shape programs, policy, and decision making. So it's not just the numbers, but how the numbers are really impacting the lives and the values and or having real impact on the ground with the communities that we serve and those who we aspire to serve as well. Beyond that, the community that emerged through the cohort, that first cohort was just as impactful. I built relationships just as my peers that have continued beyond the program. I still draw on those connections for collaboration and insights in my work from still having a one-on-one relationship, to build that professional sense with my mentor, even with the cohort and our peers as well, still being connected, still trying to find ways in how we can synchronize our work from across the region, and even more so now as we navigate so many of the global scenarios that we've been seeing. I think right now, just building that community, this program has really been there. And one thing we know beyond the waters, beyond how many miles and the distance and the sea and the land, we are all connected by one thing, which is gender-based violence continue to be a resounding global, not just a global health issue, but a global issue across all spheres of life. So looking back, the experience didn't just influence my next step. It reshaped how I think about my work more and my work more broadly. As I said, 2 years ago, I wasn't in a role that I am in now, and I feel even confidently, like I'm more confident to even take on more professional development roles as they presume themselves to me as well. So it's really an honor now to stand on this side and to welcome all three presenters today and to witness the impactful and thoughtful work that they are going to be sharing. And having worked on that work for over a year, I'm really excited to be here and to just listen and absorb all of this. Thank you so much. And it's always a great pleasure sharing this space with all of you.
Ah, wonderful. Trisha, thank you so much for your introductory remarks and for being with us in this space. You know firsthand how impactful the program is, and it's just wonderful to pass the torch as this next generation begins to share out their results. So thank you for being with us today. And next, I am just delighted to introduce today's moderator, Dr. Nancy Glass, professor at the Johns Hopkins School of Nursing, longstanding friend and founding member of the center, truly needs no introduction. And we're just so delighted, Nancy, to have you with us as a moderator today. So over to you. Nancy, you're muted.
I apologize, everyone. I am very excited to be here and have the honor and pleasure of introducing our three speakers. And let's get started. Our first speaker today is Mpho Elizabeth Mpofu is a Senior Accountability Advisor for the What Works 2 Consortium. The title of her presentation is Moving Beyond Decriminalization, Moving Beyond Decriminalization, an Understanding of LGBTQIA plus experiences in Botswana, post-2019. Mpho, over to you.
Thank you so much for the introduction. One of the research questions that I tried to answer was, what are the social cultural norms that continue to drive violence against LGBTQI persons in Botswana despite decriminalization? Why this matters is, although Botswana decriminalized same-sex relations in 2019, violence against LGBTQI persons persists with continued reports of hate crimes. Decriminalization has largely been framed as a legal and symbolic achievement. However, this framing risks obscuring the ongoing vulnerability of LGBTQI persons. The LGBTQI community lacks robust and legal protections and institutional support. Now, violence and discrimination experienced by LGBTQI people in Botswana has serious health, education, and legal consequences, resulting in poor health uptake and lack of trust in the criminal justice system. So, due to decriminalization, there are sentiments that discrimination is not currently an issue. Therefore, this analysis is to synthesize the evidence out there that shows continued discrimination and violence. It is important to note that as of 2024, about 10% of the population identified as either homosexual or bisexual. Yet, nearly 70% of the population opposes same-sex relations. For the conceptual framework, I looked at social cultural norms driving violence against LGBTQI persons in Botswana, and this was religion, patriarchy, Africanness, and heteronormativity. I then looked at the types of violence experienced by LGBTQI persons in Botswana, and this included sexual violence, physical violence, employment discrimination, stigma, and systemic violence. I then looked at the lack of systemic accountability mechanisms to curb violence against LGBTQI persons, and this would result in either LGBTQI persons having a positive or negative experience post 2019 decriminalization. Now, there is a need to understand the contextual environment that led to decriminalization. Whereas in 1964, the Penal Code outlined criminal offenses for same-sex partnerships with the penalty of imprisonment not exceeding 7 years. However, between that period and 2019, several things took place that led to change, and these included, from a public health perspective, the impact of criminalization on HIV/AIDS prevention and treatment efforts. There was also visibility of LGBTQI persons and movements that was built, several court victories for LGBTQI persons and organization, and this also includes the contested registration of Liga Bibo as an organization, and the High Court ruling that Liga Bibo should be allowed to register in the country. We also saw Vision 2016, where it spoke a lot about just, compassionate, and a caring nation, but also at the time, the president embraced LGBTQI persons. Now, all this created an environment where in 2019, the full bench was able to sit and find criminalizing consensual adult same-sex conduct was unconstitutional. Now, on the methods, I analyzed versus the Attorney General case that led to decriminalization of same-sex relationships. This was important because it gives an in-depth understanding of what had happened and how we got to the full bench decriminalizing same-sex relationships. We also conducted a literature review of relevant peer-reviewed articles and gray literature published between 2019 and 2025. With only 12 relevant and read articles for this analysis. There were more than 12 articles I found, but only 12 were relevant. I then extracted data on LGBTQI experiences and related norms. I then used a thematic analysis to categorize norms found in the literature with linkages to violences. Now, the table below just gives a broader picture of the different databases that I used, as well as the search terms and the results that I found. Now, this is a pictorial view of the socio-cultural norms driving violence in Botswana. Remember, we set off with 4. However, we found a 5th one from the review, and this was reproductive stigma, but also found the existing one that I had when I set off to do the research, which was heteronormativity, religion, Africanness, and patriarchy. Now, to contextualize the results is that when it came to religion, we found that it was a key driver as homosexuality was seen as unnatural and standing against God. And we also found that nearly 1 in 10 people say that religion plays a key role in informing their attitudes on homosexuality and gender nonconformity. For patriarchy, it was that their patriarchal systems have continued to uphold male dominance and view sexual diversity as a challenge to that control. Non-heterosexual men are seen as undermining ideals of masculinity, while LBQ women's independence challenges patriarchal norms about female submission. And here it was that the stigma is already entrenched in the society, and in the LGBTQI community with non-conforming identities are at a bigger risk of violence than non-conforming sexual orientations. When it came to Africanness as a rhetoric is frequently invoked to frame homosexuality as an African and unnatural, reinforcing stigma and discrimination. Now, there were prominent leaders that have described the LGBTQI community as an African and going against the Botswana culture. Heteronormativity was it was institutionalized heteronormativity, and discrimination are enabled by structures that are not accommodating to LGBTQI persons, leading to hate and violence in sectors such as healthcare and the justice system. When it came to healthcare, we found that healthcare workers have reinforced social stigma through abusive and derogatory language, breach of confidentiality, providing inferior or substandard care, or even threats of report to the police. The law enforcement not only perpetrates violence, but also withholds protection against violations for LGBTQI persons. And lastly, for the reproductive stigma, it was that LGBTQI persons are commonly perceived as violating dominant family norms centered on procreation with strong opposition to same-sex parenting. Here, nearly 7 out of every 10 people disagree with people of the same sex having children. Now, to give a pictorial view of the different experiences in comparison amongst LGBTQI persons, we found that verbal harassment was, this is experienced similarly across due to sexual orientation or gender identities. Sexual violence is experienced across, although high amongst lesbian, bisexual, and queer women, largely termed as corrective rape. For physical violence, although experienced across sexual minority groups, it is significantly higher amongst transgender women, transgender men, and gender non-conforming people. And it is usually around issues of power where they're disciplining those who transgress gender norms. And when it came to media reports recently have reported higher rates amongst gender non-conforming individuals, and these included trans women and trans men. Now, the implications for that, decriminalization is not enough. Norms change is required. Decriminalization alone is insufficient without strengthened accountability mechanisms to enforce protections and prevent violence. Social cultural norms continue to sustain institutional discrimination and inequality, undermining the intent of decriminalization. LGBTQI people are not a monolith. Their experiences are different. Gender continues to shape the forms and intensity of violence experienced. The experiences differ across groups. Therefore, LGBTQI persons cannot be treated as a homogeneous category. Services must be differentiated and responsive to specific identity-based and intersectional needs. And then lastly, systems as sites of harm and intervention, such as the healthcare and the justice system. We have continued system violence within healthcare contributes to poor uptake of services. The justice systems are perceived as inaccessible or unsafe. And strengthening accountability mechanisms can improve institutional responsiveness. When it and the last part was we looked at the actions, the possible things that could be done. There's a need to establish clear mechanisms to facilitate understanding and implementation of decriminalization across different institutions, with health, justice, and education. With the healthcare sector, there's a need to establish government-funded safe spaces for LGBTQI persons to access healthcare. With regards to the justice system, we need to amend the penal code and revise police training on decriminalized offenses. And lastly, for education, there is comprehensive sexual education to be inclusive of gender and sexual minorities. There's a need to strengthen collaborative efforts with traditional and religious leaders to shift social norms and reduce violence against LGBTQI persons. Support LGBTQI organizations to provide responsive, needs-based services that address the diverse forms of violence experienced within the community. And lastly, there's a need to mainstream gender equality advocacy and programming to include the LGBTQI community. This should encompass responsive reporting mechanism and accountability frameworks to ensure institutional accountability. Thank you, ladies and gentlemen.
Oh, thank you so much, Mpho. Such important work and an excellent presentation. I want to remind everybody that they can ask questions. Please feel free to put your questions in the chat because after the third speaker, we're going to have a moderated questions and answer session. So now for our second speaker, it's my pleasure to introduce Gloria Daniela Zepeda. Is a monitoring and evaluation associate at UN Women in Honduras. The title of her presentation is Factors Associated with Abandonment of Domestic Violence Complaints in Honduras, 2014 through 2024. It's the secondary analysis of administrative case records from Honduras National Human Rights Commission. Over to you, Gloria.
Good morning, good afternoon to all the attendees. Thank you in advance for your attention. Just a quick note, the Honduras National Human Rights Institution, CONADE for its Spanish acronym, is not part of the formal justice system in Honduras. It's the government institution in charge of overseeing the actions of other state institutions and giving recommendations. They also receive and accompany survivors, in this case, gender-based violence survivors. They give legal advice, legal accompaniment, orientation, and derivation to the formal justice system institutions in the country. The research question was established among domestic violence complaints submitted by women survivors to CONADE between 2014 and 2024. What factors, including survivor sociodemographic characteristics, type of domestic violence, geographic location, and complaint submission channel associate with the woman abandoning her report? Just a little context and justification on why this is important. Well, gender-based violence often progresses from less severe to more severe forms, being the most severe form and sometimes culminating in femicide. We believe that early intervention can prevent this escalation. Domestic violence is widespread in the country, but also in the region Central America. In Honduras, with an estimated 35% of women experiencing it in their lifetime. There are thousands of domestic violence cases that are registered in a yearly basis by national response systems. Yet accountability remains limited and underreporting is common due to fear, mistrust, or ineffective institutional response. Few survivors complete their formal justice-seeking processes, and systematic evidence and complaint abandonment is often scarce. So using administrative data from the CONADE, the Honduras National Human Rights Commission, this analysis examines patterns of complaint abandonment among women survivors filing claims to the institution. All this with the objective to generate evidence and inform improved monitoring of help-seeking trajectories of women survivors and strengthen their justice-seeking processes. Here's a little explanation on how we did the analysis, including the data set, the measures, and the methodologies. For the data set, we had access to the administrative case records from the institution CONADE from 2014 through 2024. Our unit of analysis was complaints, and it was domestic and intrafamiliar violence by intimate partners, current partners or former partners, and the complaints submitted by women survivors. The outcome of study, as you you saw in the research question is abandonment of the complaint. An abandonment of the complaint is clearly stated in the data set as expressed withdrawal by the petitioner. The exposures that were analyzed include age, marital status, occupation, type of violence, region, and the submission channel for complaint. After filtering for all these characteristics, the final sample was 1,782 complaints to be studied. How we did this analysis? This is a secondary analysis of administrative case records from the complaints submitted to CONADE between 2014 and 2024 for domestic and intrafamiliar violence perpetrated by a current or former partner, including these complaints are submitted by women, only women survivors. Here's a little of the results, but we will see in the next slide some of this descriptive analysis of who are the women that are reporting domestic violence and seeking help. We used StataB as a software for the statistical analysis. Here are the first results of an initial descriptive analysis that we made to the complaints according to the information that was available in the data set. First, we can see that the age range, most women survivors that are filing complaints and seeking advice and seeking this accompaniment from the institution are women between 30 and 39 years old, followed by women between 20 and 29 years old. Most women that reported complaints were single, followed by women living in free union. You can see the majority of women that are filing complaints and seeking help and support and accompaniment from the institution are women that stay at home, followed by women that worked outside their homes. The region that stands out in the complaint reception is the Northwest region, followed by Central East, Central West, and West. So we can see West standing out in these regions. Later in the presentation, we will see a map containing all the regions. And the complaint presentation channel mostly used by women survivors is in person, followed by digital presentation, which can include email or phone, WhatsApp channels of presentation. Here are the first results, also included in the exposure, which is domestic violence complaints by type of domestic violence. This type was determined by the data set itself, how the institution registers each case and identifies each case. So of all the domestic violence complaints presented by type, most of the complaints represent psychological domestic violence with 35%, followed by economic domestic violence in 29% and physical domestic violence in 26%. The least complaints represent intrafamily violence from a partner, current or former. This intrafamily domestic violence characterizes because it's recurrent domestic violence of all types. Here's the outcome that we studied as the principal outcome. So this is the status of the domestic violence complaints submitted by women survivors to CONADE in Honduras between 2014 and 2024. And we can see that only 5% of the complaints were abandoned by women survivors. And as expressed before, this abandonment is stated in the dataset as expressed withdrawal by the petitioner. Here, after making some bivariate associations and followed by multivariate associations, adjusting for all variables, we can see the first exposure, the first association, and how does women survivor employment associate with domestic violence complaint abandonment. So when making the first bivariate association, we found out that women working outside their homes, which were much more less likely to abandon their complaint than women that were retired or were students. So this had an economic implication that women with their own income were less likely to abandon their complaints. However, after adjusting for variables using the stay-at-home as reference, we can see that employment or occupation was no longer significant, not undermining that bivariate associations gave significance to women that had their own income. The second association we made is regarding the type of violence that women survivors report and how it associates with the abandonment of their complaints. So we can see here that even while making the bivariate associations, but then multivariable associations and adjusting for all variables using psychological domestic violence as reference, economic domestic violence is significant in association with the complaint abandonment, meaning that women reporting economic domestic violence, even after adjusting for all variables, are still less likely to abandon their complaints. The other factor that became significant when making bivariate and multivariate associations was the region of the women presenting domestic violence complaints. So this map represents, this is a map of Honduras, and it represents the regions. So domestic violence complaint abandonment by region among women survivors who reported a complaint. When making bivariate associations, it was statistically significant, but even when adjusting for all variables, we see here that the Western region, and using the Northwest as reference as the region with more complaints, the Western regions continues to be more significantly less likely to abandon the reports as compared to the Northwest regions. Same with the Central East region and the South regions. So in the map, we can see that the lighter regions, the lighter in color, are much more less likely to abandon the reports, even after adjusting for all other variables. So these were the three factors that we found statistically significant associated with complaint abandonments: women occupation, type of violence, and region. So just implications to these results that we found extremely interesting. And we found that in some cases come and give meaning to many assumptions and many perceptions we have in the country regarding domestic violence. So data is giving strength to many discussions and many narratives. Number one, as women with access to personal income are less likely to abandon their complaint, early assessment of economic challenges for women can allow not only CONADE, but also other state institutions to develop tailored strategies for identifying women and minimize their exposure to domestic violence. We believe that additional collaborative studies are recommended to better understand these help-seeking trajectories that women survivors live and to inform institutional response. These studies are recommended across regions, across different types of domestic violence in the country. Also, leveraging the study findings and future research collaborations with other sectors of the formal justice system that may also have their data sets are needed to advocate for resources and to inform public communication strategies that surely will strengthen evidence-based public policy design and program designs to prevent and respond to domestic violence survivors. Finally, the findings suggest that geographic and violence type factors may be more decisive than individual or procedural characteristics in complaint abandonment. So Honduras, not only CONADE, but Honduras as a country, as a state, so CONADE, other institutions, and other partner organizations can use this evidence to identify structural barriers, reinforce women's access to justice, and prevent the escalation of violence. Here are the references used. You can access when accessing the presentation itself, and thank you very much for your attention.
Thank you, Gloria. Thank you for such an interesting presentation. Please remember, you can, if you have questions for Gloria or Mpho, please feel free to add them to the chat. For our third presentation today, we have Gullan Ismael Mawlood, who is a consultant at the Safe House for Human Empowerment Center. The title of her presentation is Perceptions of Appropriate Age of Marriage Among Adolescent Girls in the Kyrgyzstan region of Iraq. Over to you, Gullan.
Today I'm pleased to present the findings of my study on adolescent girls' perceptions of the appropriate age of marriage in the Kurdistan region of Iraq. This research was conducted with the support of the Johns Hopkins Evidence Accelerator Fellowship, and I'm excited to share how these findings can help inform future strategies and interventions against child marriage. This study was aimed to answer two key research questions. First, we wanted to understand what adolescent girls believe to be the appropriate age of marriage for both girls and boys, and we also explored which sociodemographic factors influence girls' perceptions of the appropriate age of marriage for girls specifically. Understanding these perceptions is important because attitudes toward marriage age often reflect broader social norms, expectations, and structural inequalities within communities. Child marriage remains a serious concern in Iraq and the Kurdistan region. Although the legal age of marriage in Iraq is 18, many marriages occur before that age. Estimates suggest that around 28% of girls marry before turning 18. Many of these marriages happen outside formal legal systems, though some are approved by judges. Moreover, there have also been discussions in the Iraqi parliament about lowering the legal age of marriage, which raises significant concerns about the girls' rights and protection. We all know that child marriage can negatively affect girls' education, health, economic opportunities, and overall well-being. Importantly, girls' perceptions about marriage age are shaped by social norms, knowledge, and demographic factors. Understanding these perceptions helps practitioners and policymakers design targeted strategies to delay marriage and protect adolescent girls. This study was guided by a conceptual framework that looks at three key categories influencing perceptions of marriage age. The first category is sociodemographic characteristics, which include factors like age, education level, ethnicity, geography, and displacement status. The second category is knowledge and awareness, such as whether girls understand the legal age of marriage, the health risks associated with early marriage, and whether they have been exposed to educational programs. The third category is social norms, including expectations from family, community about when girls should marry. These factors together shape how adolescent girls form opinions about the appropriate age of marriage. The study utilized data from the UNFPA Johns Hopkins Child Marriage Survey in the Kurdistan region of Iraq in 2019. The analytic sample included a representative sample of 1,970 adolescent girls aged between 10 to 19 in Erbil, Duhok, and Suleymaniye. Statistical analyses were conducted using Stata software. Bivariate analysis using chi-square tests examined the associations between sociodemographic characteristics and adolescent girls' perceptions of the appropriate age of marriage. Our first figure shows the percentage of adolescent girls who believe the appropriate age of marriage is below 18, separately for boys and girls. One important pattern we observe is that more girls consider marriage under 18 acceptable for girls than for boys. This highlights the presence of gendered expectations around marriage timing, where girls are often expected to marry earlier than boys. This graph presents how perceptions vary by different sociodemographic characteristics of adolescent girls. Factors such as age, education level, and marital status influence how girls perceive appropriate marriage age. Approximately one of 1/3 of girls not attending school perceived the appropriate age of marriage to be under 18, compared to 11% of those attending school. 42.3% of ever partnered girls perceived the appropriate age of marriage to be under 18, compared to 13.4% of never partnered. Just over 1/3 of girls who have ever given birth perceive the appropriate age of marriage to be under 18, compared to 16.7% of girls who have never given birth. Here we see how perceptions vary across governorates, displacement status, and ethnicity. In Erbil, 24.6% of girls perceived the appropriate age of marriage to be under 18, followed by 16.8% in Duhok and 10.4% in Suleymaniye. Acceptance of marriage before 18 was high among refugees and internally displaced populations. Nearly a quarter of refugee adolescents perceived the appropriate age of marriage to be under 18, compared to 15.7% of internally IDP adolescents, and 14.7% of host community adolescents. This may reflect the additional economic and social pressures faced by displaced communities. Higher portions, which was 26.1% of Turkmen and 22.8% of Arabic adolescents, perceived the appropriate age of marriage to be under 18, as compared to 16.2% of Kurdish and other 6.3% of ethnicities. These notable differences across geographic areas and ethnic groups indicate that cultural and contextual factors strongly influence perceptions. Exploring on how family and household characteristics influence perceptions of marriage age, among else from lower income households, which was 19.2% perceived marriage under 18 as appropriate, compared to 3.1% of girls from higher income households. By parental education level, 4.9% of girls whose parents had higher education perceived a marriage under 18 as appropriate, compared to 11.8% for those with secondary educated parents and 15.1% for those with primary educated parents. This percentage was highest among girls whose parents had no education, which is nearly 1 in 3 girls who experienced the death of a parent perceived marriage under 18 as appropriate, compared to 15.7% of those who had not experienced parental death. Factors such as parental education, household structure, and parental presence can shape how girls view marriage. The last graph focuses on adolescent girls' agreement with specific social norms related to marriage and gender roles. A significant proportion of girls agreed with statements related to family honor and male decision-making authority. These findings highlight how deeply embedded gender norms continue to influence girls' perceptions and expectations about marriage. Addressing these norms is essential for sustainable change. Based on these findings, several programmatic and policy implications emerge. First, interventions should work to challenge gender norms that promote earlier marriage for girls. Second, programs should provide support for married adolescents, including reproductive health education, counseling, and economic empowerment opportunities. Also, displaced populations should be prioritized, as acceptance of early marriage was high among refugees and IDP communities. Fourth, engaging community and religious leaders is essential to challenge traditional beliefs that reinforce early marriage. Finally, programs must be culturally sensitive and context-specific, particularly in conservative areas and among different ethnic communities. Thank you very much for your attention. I hope these findings contribute to ongoing efforts to prevent child marriage and support adolescent girls in the region. I would now be happy to take any questions or hear your reflections. Thank you.
Thank you, Gullan. That was excellent. Well, we've had three excellent presentations, and I think that if Michelle agrees, we can open the floor for Q&A or
Absolutely. I think this is a fantastic time for questions and discussion. We saved a bunch of time at the end for this, so looking forward to seeing everyone's questions come in through the Q&A. Thank you.
I'm not seeing a question. Are you, Michelle?
I'm actually not seeing any questions in the Q&A either. Feel
Well,
free to tuck them in the Q&A or in the chat.
yeah,
And Nancy, I'm sure you've got questions to kick us off too. And
I
invite our
do.
panelists as well. Yeah.
If I could ask a first question for
Yeah.
Mpho. Um, I I was just wondering, as you were looking at the data across the systems, especially for a healthcare, as a healthcare provider, have you noted any specific training that has been provided for healthcare providers since the 2019 criminalization? And if so, what type of training has it been? And do you think that it is enough?
Thank you so much, Dr. Nancy, for that question. So, one of the challenges that are there is the country and its systems are still functioning as though it is pre-2019, before decriminalizations, where there isn't any training that has been put in place. So, one of the things that were there, or what LGBTQI persons used to get access from when it comes to healthcare, was LGBTQI focused spaces, which were largely USAID or donor funded. And with the funding cuts, a lot of that has gone away. So LGBTQI persons are now forced to go back to mainstream healthcare systems that have not received any training. And even in those systems, it's largely you find healthcare providers are reinforcing their beliefs and norms that they have, and then they are projecting them to the clients that they're supposed to be servicing. So there isn't any training, and this is why you see a poor uptake of healthcare services from LGBTQI persons, based on the fact that it's like there isn't any decriminalization, and this is why we're saying for decriminalization to actually work, we need to address social norms, and that actually goes into changing the way the healthcare system is provided.
Yeah, that's a super important point because we often forget, well, we don't forget, but the healthcare providers, the nurses and the physicians and the social workers, they carry the same norms as others in the community. So, really taking on the norms is incredibly important. Good point. Other questions? Well, then good. I'll ask a second question. Gullan, I find your work really fascinating. Could you talk a little bit about some of the contextual challenges with doing or what you think what program would be helpful in changing norms and within the contextual challenges that you've noted?
Yes. Regarding the findings that we found that adolescent girls that mostly that are not attending school, or those who are like from IDPs and refugees had higher acceptance to marriage under 18. I think that working with families and um, working with families and enforcing the legal age of marriage to be above 18 and above, and also working with like strengthening access to education so that girls can attend schools, even though like there are a lot of camps, IDP and refugee camps here in Kurdistan, like promoting education and helping them to access education, the adolescent girls, would be very beneficial for them because we found out that most of the girls that, even though they agreed to marriage under 18, still they were more likely to, to have the aim to attend schools. And we found out that those girls that attending school had lower acceptance to marriage under 18. So I believe working with families, community leaders, and like adolescent girls of refugees and IDPs would be very beneficial for them. Thank you.
Great. We have a follow-up question for you, Gullan. In your opinion, what is the policy appetite for these data? How have you had a chance to share your data, and what has been the response and thoughts among colleagues or other organizations around how do you create the change you're talking about, the work that needs to be done?
Yeah, still I haven't shared my findings with like the CSOs and policymakers, but it's in my plan to share the findings with them because the findings are interesting and would be a great, let's say, create a brief and a great action steps for them to follow. So I believe it will be very beneficial for them. And here in Kurdistan, it has been very challenging working with the laws because in 2024, there has been a lot of discussion to lower the age of marriage to 9. So in 2024 and 2025, having this discussion in the parliament and trying to lower the age of marriage to 9 is very, very controversial now. So I believe the findings will be very great and will be very good to share with the policymakers and with the CSOs and those who are working on GBV and against child marriage.
Wow, excellent. Very timely findings, right? Right, as these controversial discussions are ongoing. Gloria, thank you so much, Gullan. Gloria, there's a question for you. Thinking about the advocates, the systems that support, what might help to sustain these cases rather than withdrawal? Even though we didn't see a large number of withdrawals, we do have some. What might the next steps be in this setting to further reduce abandonment of cases?
Thank you, Dr. Nancy. Well, yes, just considering it, the National Human Rights Institution is just like an initial step on women's trajectory for seeking justice and for asking for help. I believe these results give us like insight for more meaningful questions on how we gather qualitative data. But the result itself, the outcome studied on abandonment, just knowing that it is very low, it's 5%, contrary to what many beliefs in the country, that women constantly abandon their processes or they don't even report. So just the outcome itself, I think, gives us like light to collect more meaningful data on what's happening. So because we have this evidence that is telling us that when women are accompanied, they are not abandoning the reports. So we're not still entering the formal justice system. We're just working with an institution that accompanies women both legally but also with orientation. So perhaps we can ask ourselves, do we women really know how the justice process works in the country? Because with accompaniment, we're seeing they're not abandoning. So I believe that's one of the first things we should analyze, that the National Human Rights Institution is not the only institution that gives women this accompaniment. We have women organizations, women civil society organizations. We have other women state institutions. And, in the last years, the Women Affairs Ministry was created. So perhaps getting to understand what's happening, because women with accompaniment are not abandoning their processes. So knowing why, perhaps they feel safer, they feel more listened to in the formal justice system, or perhaps we don't know how the process works and we need that orientation. So that's on a first just step now. So, and this is really important for advocating for resources also, especially in this context we are living in the country where resources have been extremely cut in gender-based violence areas. Also, with the associations that came significant, including type of violence, perhaps, and the economic factor we're seeing, because women with an income are less likely to abandon their reports, just meaning that we need to continue working on women economic empowerment programs, on women economic empowerment interventions, because we now see evidence that it is related to women reporting and not abandoning the reports. Also an economic factor in women reporting economic violence, which is mostly like lack of support from their partner for the raising their children. So just also making these campaigns for women to know that there is also a legal framework that accompanies them. I think perhaps those strategies from the evidence, also the regions make gender analysis per region that more comprehensive gender analysis that covers all these gender dimensions that they had been done, but they could be made more comprehensive, understanding how services and products are available in the regions, what roles and responsibilities women are expected to act upon, how social norms are ingrained per regions, and also how all these economic factors play a role in the autonomy of women and their power for own decision making. Thank you, Dr. Glass.
Thank you. Thank you. Such an interesting findings around the economic process and the importance in continuing the complaint. So we're almost at time, but I do have a brief question for each presenter, just very brief. There was a question about the ethical challenges of doing this work. All of you, even though some have done some administrative records, but what are some of the ethical considerations that you take into account when doing this work with vulnerable adults and also children? If you could briefly respond. I'll start with Mpho.
Thanks, Dr. Nancy, on that. So I did a qualitative study, mostly text review, but it is very important to understand lived experiences, but also respect the experiences of LGBTQI persons. Currently, what is there's a misconception in what is out there and the actual lived experiences. So a lot of research is telling the story of LGBTQI persons, which is oftentimes not what they're experiencing. Is when we were doing the study, thanks to my mentor, Dr. Anna, we looked at, I also went in with perceived social norms that were there. And she encouraged me to look at, okay, those are the norms that you think are persistent? What is it that you're finding? What else is out there that is coming out? And so went in with an open mind and found out there's a lot there are a number of social norms that are impacting LGBTQI lived experiences. So ethically telling the story, stepping us away from being the researcher, being the know-it-all, and actually telling the story of the lived experiences of people. Yeah.
Thank you. Oh, that's very helpful. How about Gullan? Could you give us a little your thoughts on doing such important work, but really with young adolescents?
Yeah, my study was based on secondary data. However, the original data collection followed strict ethical standards. These included obtaining informed consent from participants and their guardians, and with the also assuring confidentiality by using non-identifiable data and protecting participants from any potential harm. So in my analysis, I maintained these standards by using the data responsibly and ensuring that no individuals could be identified.
Thank you. Excellent summary. That's very important. And Gloria, could you provide your thoughts on the ethical standards with administrative data?
Yes, I mean, that was I believe, one of the first considerations, and still we had the considerations with you, our mentors, the center, and and also with the institution, with the National Human Rights Institution. But being administrative data, we had the caution to, and because we're speaking about women survivors of domestic violence, we know that reporting, and I see some questions on the chat, that sometimes reporting may increase the risk. We also need evidence on that, and on that, I believe that's one of the possible action steps, because abandonment may not only be studied as abandonment, but also as what implies, or why could it be a protective factor for them? We don't know. We need more evidence. But regarding ethical standards, we had the cautions, the institution itself, they had the cautions to give data, not including any personal information of women survivors for this study, not names, not personal IDs, just to protect them and to give just evidence based on characteristics, general characteristics, rather than personal data. Thank you, Dr.
Thank you, Gloria. I just want to thank our presenters and congratulate them on their amazing efforts and their presentations, and hand it over to Dr. Michelle Decker.
Wonderful. Wonderful. Thank you so much. Just echoing and invite our presenters to come off screen mute just for a minute so we can really appreciate and celebrate the work that you've done. Huge thanks to Dr. Glass for moderating, to Trisha for being part of this, and to our entire team at the center for the mentorship and the support and just bringing us to this point. It's so incredible to hear the learning from all of these different sessions and sectors. And really the evidence moving us forward, whether it's social norms change, the interface with policy, the sustained commitment and the work that is needed even after policy change, as we've heard from Gloria and from Mpho, and then the norms change that is needed to really protect young people. So Gullan and everyone, thank you so much for joining us. Look forward to continuing the conversations on LinkedIn and beyond. And thank you once again to our audience for such a rich discussion as well. Thanks.